This is your ICD 10 PCS book, guys. So once you open the book, first you can check the table of contents. For every book, table of contents should be important. In the table of contents, you will get everything about the book. On the particular page, what they documented, clearly you will get in the table of contents. So here, ICD 10 PCS also divided as index and tables. Index and tables. Index like dictionary. Okay, you will get A to Z codes in the index. I am going to index, so I will show first how to lead the code in index. So here you will get all the codes sequence wise, dictionary type A to Z. Okay, A series to Z series you will get. Minimum 4-digit code you will get in the index. Maximum sometimes you will get 7-digit, 6-digit, but minimum 4-digit code you will get in the index. Index. So first, if you lead the code directly in the index, we don't get, guys. Suppose if you searched appendectomy, I will show for example. They done the appendectomy. Appendectomy means removal of appendix. If you seen what they mentioned here, C excision, C resection, correct?
Yes.
C excision, C resection they documented. If we don't know the meaning of excision or resection, can we get the code?
Zero.
Correct. If we know the meaning of excision or resection, then only we can get the. Otherwise, it was very difficult, right, to get a code.
Yes.
So first thing, we need to identify the root operation. Suppose if you know the meaning of excision, you can go with excision. If you know the meaning of resection, you will go with resection. But you don't know excision and resection definitions, then it will be difficult. So compulsory we need to know about root operation. If we don't know the root operation, difficult, guys. So first thing, remember, compulsory identify the root operation. After the root operation identification, under root operation heading, search the body part. Under root operation heading, search the body part. You will get the 4-digit code minimum. Clear? Now, after identifying the 4-digit code, suppose they done the appendectomy completely, which means excision or resection.
Section.
Section.
Section. So now we need to go with the resection and appendix. Under resection, check appendix. What you find under resection appendix? Under resection, appendix 0DTJ. correct?
సార్ కోడ్లో ఇస్తారా సార్ ఇట్లా రిసెషన్ ఐడెంటిఫై చేయడానికి రిసెషన్ అని అట్లా అలా
No,
ఏం
we
లేదు.
need to identify the root operation. They don't give. Just they will give a procedure. I will show one example how we will get the operative note and all. First learn the book reading, then I will show how we will get the procedure in the exam. Clear?
Yeah.
So 0 DTJ you get. Now we need to go for the table of contents. Here under the ICD 10 PCS tables, you will get the sections medical and surgical. Here you will get all the codes and sequencing range. So 0 DT means you will get in this range, right? So 0, 0, 0, 1, 0, 2, 0, 3. Here you will get sequencing 0 D1 to 0 D1Y. In between you will get. So we need to go for the particular page numbers. So in the top you will get 3 digit, first 3 digit, and they divide the table body part, approach, device, qualifier. In the side also you will get, you are in the particular which page. In the top also you will get. On the particular page, what are the ranges you will have. First you will get the numbering, then letter 0D1, 0D2, 3, 4, 5, 6, 7, 8, 9, 10, B, C, D, F, T. I need T, so I need to go forward pages. Still 7, 9, B, D, F, H, J, P, Q, R, 0D, T. Here they documented 0D, T. And what is the fourth character? J, right? J we have in the two tables. Here and here they documented in the two tables. So whenever they done open approach via natural or artificial opening, via natural or artificial opening endoscopy, this table we need to use. Whenever they done laparoscopic appendectomy, we need to go with particular table. Okay, check same body part. Sometimes they will give in the 2-3 tables. For fifth and sixth character they will give different. We need to look. Do not confirm here only. Here also they given check. Suppose they done laparoscopic appendectomy 0 DTJ 4 Z Z. If they given only appendectomy, they not mentioned laparoscopic, then 0 DTJ 0 Z Z. Do not cross the tables, okay? Suppose if we take a body part here, we need to take the approach, device, qualifier all in the same table. They cross the line, na, the table was end. We should not take like this from here to here, here to here. We should not cross the lines, guys. Compulsory, we need to follow the table. If they complete the line, the table was end. Got it? How you get a complete code now? What is the open appendectomy code? Tell me now.
JOZZ. DT JOZZ.
0 DTJ O or 0 Z.
Oh,
Now, in the exam, everything should be optional. Okay, everything should be optional, and they don't give a single line procedure. They will give the report, and we need to identify what procedure they performed exactly. Okay, and we need to identify the answer based on options. I will show one example how we will get the multiple choice question. Identify the seventh question. A patient undergoes laparoscopic resection of the sigmoid colon. What is the correct ICD-10 PCS code? This is the procedure. They given 4 options. See, while you are seeing the question, check the approach, what approach they used. First identify and identify the root operation. These 2 things we need to identify in the record. What approach they used here?
Percutaneous endoscopic.
Laparoscopy means percutaneous endoscopy. Then, what procedure they performed? Resection of
Resection.
sigmoid colon. Resection was the root operation. Approach should be percutaneous endoscopy. We need to aware of approach values, guys. External X, open 0, percutaneous 3, percutaneous endoscopy 4, via natural or artificial opening 7, via natural or artificial opening endoscopy 8, via natural or artificial opening with percutaneous endoscopic assistance F. These values definitely you need to remember. It is helpful. Now see, laparoscopy means percutaneous endoscopy. What is the value for percutaneous endoscopy approach?
4.
4. In the options, check the 5th character. How many options have 4?
2. B, D.
2 options. B and D, correct? So now A and C we can eliminate easily, correct?
Yes.
We need to check B or D as the answer. Now check B and D. Which character value they changed?
Third. Third. Resection and excision.
Third character. What is the third character value? Root operation. Correct? Root operation. T means what? B means what?
T means resection.
Section B means excision.
If you go to the table of contents, under appendix B something, under appendix B, you will get all the root operation definitions and values. No need to remember the values if you are unable to remember. Here also you will get everything in the book we can get. We need to go just for the particular page. So here check excision value, excision B, resection, T, correct? Now what is the root operation? Resection, right? So 0 dt, you will get 0 dt n 4 zz. Option B correct answer? Yes. No. I don't want this and all. I will lead directly means under resection colon sigmoid. Check. Under resection colon sigmoid. Under resection colon sigmoid 0 dtn, same, right?
Yeah.
Then percutaneous endoscopy 4 zz. That's it. Like this, we need to eliminate the options in the multiple choice. Now, in the case studies, how you get the options, how we need to find the answer. Case studies, how to get the answer. See, this is the case study, guys. Case study will get like minimum 3 to 4 pages, entire document. In the case study, we need to identify ICDs and procedures, either CPT procedure or PCS procedure. Inpatient means we will get PCS procedures. Outpatient means
Hello, sir. Voice going. Hello, sir. Voice.
left lung, correct?
మీ వాయిస్ కట్ అయిపోయింది సార్ ఇందాక.
Sir, your voice is not audible.
Hello.
It's breaking in between.
Hello, now I am audible or not?
Yes.
Yes.
Yes, yes.
So recurrent carcinoma of left lung. Check this document completely and identify the diagnosis. Then we need to identify the procedure. One case study, 40 marks. One case study, 40 marks. Total 7 case studies you will get in the exam. In the out of 7, one case study will go for the choice. Remaining 6 case studies you will get the score. 6 into 40, 240 score. Like this 7 charts we need to do. Directly we should not code anything. Based on the options we need to select the codes. Okay, just review the document and identify the diagnosis what you found here.
Current
Carcinoma.
Recurrent carcinoma.
Recurrent carcinoma left lung, correct?
yes.
Then there is no any diagnosis, correct? Now past medical history read. Sorry guys, 1 minute. So here past medical history you can read what they documented and identify the diagnosis. You will get like this complete chart guys. We need to do 7 case studies. So you need to understand the documentation. I will help you. Okay, who are not aware of documentation leading, I will give some practice charts to identify the diagnosis. So now you can go through the history and identify the diagnosis what you find.
Hypertension.
Positive for tobacco abuse, 2 packs per day, 30 years in the past. History of smoking, correct? Hypertension, degenerative joint disease of lumbar spine, chronic pulmonary disease. The patient also suffered stroke in the left brain with resulting hemiparesis 3 years ago. Hemiparesis also have 3 years ago. These all are the diagnosis. Then they given the medication. So physical examination they given, operative findings they given. Okay, instructions and discharge they given, and HNP documentation they given. Okay, and impression what they documented here. Carcinoma lower lobe lung. This is the main reason. This is the diagnosis we need to check. Carcinoma of left lower lobe lung.
Then this will be the PDX, right?
Correct. Then operative report you will get. In the operative report you will get the procedure, what they performed. Here recurrent carcinoma of lung, general endotracheal anesthesia given. There was a large mass in the left lower lobe. The patient was prepped and wrapped in the Usual fashion, following thoracotomy, the left lung was completely removed. What procedure they performed here?
Lobectomy.
Left lung.
Lobe or lung?
Lung.
Lung.
Lung removed, right? Not lobectomy. Left lung was completely removed.
Lungs.
The left lung was completely removed. A muzzle flap was covered the bronchial stem. During the procedure, the patient experienced an episode of hypotension, which means post-procedural hypotension was developed. Watch resulting MI. MI was not developed, they are checking. Still watch for the result. The patient fluid resuscitated, sent to the recovery room in the good condition. So what procedure they done? Left lung was completely removed. Like this, you will get a operative note in the exam. Now you need to identify the root operation for the particular procedure and body part where they done the procedure. What is the root operation? Tell me here.
Section.
Exception.
Resection.
Resection.
Resection. Under resection, lung. Correct.
Lung. Left lung.
Left lung.
Lung left we need to identify. Correct.
Yes.
Now you will get the options in exam point of view. I will show procedure. Okay. Like this. This is the procedure options, guys. Total this many codes they given for the procedure. If there is no procedure in the exam, if they given the options like this, we need to identify the procedure. If there is no procedure in the document, we need to select the none apply, guys. If there is a code, we need to go with particular procedure. How many codes they documented, we need to select the particular codes. I'm showing in the PDF format, but in the exam point of view, we will get beside the option bubbling. We need to select the bubble. Okay, it was PDF, so it was not showing bubble. I will show real time how we will get the exam. We will get option beside the code. We need to select the option. So now we have the procedure right here. We have the procedure in the document or not? We have the procedure. Left lung was completely removed now. So none apply, we don't get. Now check in these options, what is the technique you use to eliminate first method? Or you will go for each code.
We'll search resection.
You will search the resection, right? What is the resection value? T. We have H and I. Only two options we have T in the third character. Correct? Remaining all options eliminated. Just check 0BT, 0BT, B0ZZ, L0ZZ, which means fourth character they are changing. Fourth character was body part. Now, we need to go for the 0BT in the tabular list and check what is the B value and what is the L value. Go and check.
Bro,
What is the value?
I have a doubt. So whether the YouTube session classes will be deleted or it will be stayed in the YouTube.
It will be stay only for some days, not intake.
So how long it will be?
1 month like that.
Okay.
Up to June ending, I will put.
L, sir.
Okay.
Yes,
Yeah.
I
Sir,
That's
can you show me? I
0
didn't.
BT L. L means left lung, correct?
Left lung.
B means
lower lobe bronchus left.
lower lobe bronchus left. So here they done left lung. So 0 BT L. This is the answer. Like that we need to select. Clear?
సార్ ఒకసారి చూపించరా మీరు?
చూడండి, నేను ప్రతిదీ చూపిస్తా అంటే మీరు నేర్చుకోలేరు. ట్రై చేయండి, మీకు ఎక్కడ డౌట్ ఉందో అడగండి, నేను చెప్తాను. ఎందుకంటే ఒకటి రెండు చూపించచ్చు, డైలీ 100 ఆఫ్ క్వశ్చన్స్ చూపించాలంటే అవ్వదు కదా. సో మీరు నేర్చుకున్నారనుకోండి, ఏం చేంజ్ చేసినా కూడా ఈజీ అవుతుంది మీకు. ప్రతిదీ మీరు చూపించండి, మీరు కోడ్ చేయండి అన్నారనుకోండి, మీరేం నేర్చుకోలేరు అనమాట. సో ఫస్ట్ చూడండి, ఇక్కడ 0 BT అంటే ఎక్కడ వస్తుంది మనకి? ఈ సిరీస్ లో కదా, అవునా? రిప్లై ఇవ్వండి.
Yes.
ఇక్కడికి వెళ్ళాలి మనం, ఈ పేజ్ రేంజ్కి వెళ్ళిపోండి. తర్వాత చూడండి 0 BT కదా, ఈ స్టాప్ లో చూసుకోండి మీరు ఏ పేజ్ రేంజెస్ లో ఉన్నారో మీకే అర్థమవుతుంది. నెంబరింగ్ ఉంటే లెటర్స్ వచ్చే వరకు వెళ్ళిపోండి. లెటర్ కూడా టీ కాబట్టి మీకు ఎండింగ్ లోనే వస్తుంది కొంచెం. 0 BH LM PQRS T 0 BT. సో ఇక్కడ మనకి 4th క్యారెక్టర్ ఒకటే డిఫరెన్స్. బి ఏంటి, ఎల్ ఏంటి? ఎల్ వచ్చి లెఫ్ట్ లంగ్, బి వచ్చి లోయర్ లోబ్ బ్రాంకస్. మనకు చేసిన ప్రొసీజర్ ఎక్కడ? లెఫ్ట్ లంగ్. సో 0 BT L 0 ZZ. దట్స్ ఇట్. క్లియరా? అర్థమవుతుందా అండి?
Yes, sir.
Sir.
So if you remember, if you understand book leading, then it will be easy, because we need to follow the 31 root operation examples. We need to learn 31 root operations. So we need to practice 100 of examples. I will give the exam questions. You need to do mock exams, everything. Okay. Now you get idea how to do a case study and how to do a multiple choice question in the exam point of view.
Yes, Shiva.
So nothing has directly codable. Everything should be optional. And excision and resection root operations also clear, right?
ఇది ఆర్ట్స్ పట్టుకుంటా అనుకుంది.
అర్థం కాలా బ్రో?
ఓకే తంబి. ఓకే తంబి.
సార్ కేస్ స్టడీస్ కి క్వశ్చన్ ఒక్కటే ఉంటుందా సార్?
3 questions we get: principal diagnosis, secondary diagnosis and procedure. So here see, this is the procedure, no? Principal diagnosis, secondary diagnosis also will get ICD codes. Total 3 questions. PDX 20 marks, SDX 10 marks, procedure 10 marks.
ఓకే
సార్ దానికి డిఫరెంట్ పారాగ్రాఫ్స్ కూడా ఉంటాయా సార్ క్వశ్చన్ కి? ఇందాక నా నెట్వర్క్ స్లో ఉండే. ఇందాక ప్రొసీజర్ కి డయాగ్నోసిస్ కి డిఫరెంట్ పారాస్ ఉంటాయా
క్వశ్చన్స్ డిఫరెంట్ ఉంటాయి. ఇదిగో ఇలా ఇస్తాడు, ప్రిన్సిపల్ డయాగ్నోసిస్ క్వశ్చన్ డిఫరెంట్, సెకండరీ డయాగ్నోసిస్ క్వశ్చన్ డిఫరెంట్, ప్రొసీజర్ క్వశ్చన్ డిఫరెంట్. బట్ డాక్యుమెంట్ మొత్తం కలిపే ఇచ్చేస్తాడు, అందులోనే మనం వెతుక్కోవాలి.
ఓకే.
They will give the entire document how we are coding regularly. One document is you will get 3 to 4 pages. In that we need to
identify. ఉంటదా సార్? కంటిన్యూస్ గా ఉంటదా?
Not para andi, it was like documentation. Documentation was not para type. You will get headers, everything like this. You will get the document. This is all the entire document. Like this you will get the entire document. We need to learn what they done: discharge, diagnosis, past medical history, physical examination, operative notes, instructions, HNP. 4-5 pages document you will get. Multiple choice para type, okay? 4 to 5 lines. Case studies you will get documentation wise.
Sir, was there a secondary DX question for this example that we were discussing?
Yeah, we have examples now. We have a lot of SDX right in the past history. Suppose this is the principal diagnosis C3432. Now, same code they given in the SDX. Can you code again?
No.
Only one diagnosis one time. Then leave it. So like this, you will get the secondary diagnosis, some codable diagnosis are codes, some non-codable diagnosis codes. In this, we need to filter the diagnosis. What are the choosable diagnoses we can select? Suppose patient have hypertension, select. Then hemiparesis, hypotension, COPD, DJD of lumbar spine, history of smoking. These we need to pick.
మల్టిపుల్ ఆప్షన్స్ పిక్ చేసుకోవచ్చా?
It will be here. If you click, all should be select. We have negative score also in the case study, secondary diagnosis and procedure.
For secondary diagnosis, only one ICD is applicable or multiple ICDs could be applicable if it
Depends
is
on the
there.
document. How
If
many
it's there in the
ICD is
document?
codable? If there is multiple diagnosis in the document, we need to select multiple.
But PDX would be one only, right?
Yes. PDX
Okay.
only one.
One, right. Okay. And secondary could be multiple depending upon the documentation.
Exactly.
Okay.
So here, four
I have a
diagnosis
question.
codable. 1 minute. Here, 4 diagnosis codable. We need to select the 4. If you suppose you can select 5, 6, it will lead to minus score. 4 codable, you selected 2, you will get half score. 1 diagnosis codable, but you select all the 10, it will go to the minus score. Depends
If
on
we-
how many codable, we need to select the particular exact diagnosis.
Suppose 4 are there and we code 3. So if you're missing out
You will
one,
get 1.5 marks. Total 10 marks for the secondary diagnosis question.
okay.
You will get 7.5. Suppose 4 codable, 2 coded, 5. 2 codable, you coded 4. 2, 0, 2, what exactly what you selected 2, 2 wrong. 2 correct, 2 wrong, so 0. If you selected 3 wrong, minus 2.5. 4 wrong, minus 5. Depends on how many we added unnecessarily, how many we missed codable diagnosis. Based on that, we will get the negative. Then
I have a question.
ఓన్లీ కేస్ స్టడీస్ కి మాత్రమే నెగిటివ్ మార్క్స్ ఉంటాయా?
exactly. Only for case studies negative, multiple choice no negative.
So what if the use additional
What is the?
code
I didn't get you.
is there? What should we do? If use
I didn't
additional
get
code
your
is there,
exact why.
you
We need to select as
Use
the
ad-
SDX, use additional code in SDX.
additional code ICD DX.
Yeah.
So
What
how
are
we
you
can
are
se-
asking?
can you
For some diagnosis, they documented use additional code.
get
How we need to code that
can
additional code? You
you
are
hear
asking,
me?
right?
Yeah, yes.
Your question asked properly, bro. Or what I asked
Am I
correct?
audible?
Yes. Suppose
Hello,
the
am I
given.
audible?
Yes.
Yes,
DM
the question is
CKD.
right.
DM and CKD. So we need to code 2 codes, right?
Yes.
So one should be PDX. What about additional code you are asking? Correct?
Yes.
Additional code as SDX. That's it.
Okay. So if the patient is taking long-term drugs, so it will be also fall under
Whatever
second
is,
DX.
all are secondary diagnosis only. Long term is of medication, social history like smoking status, alcohol status, surgical history. All we need to consider as SDX only.
The chief complaint will be the PDX, right?
Chief complaint related diagnosis. I will explain the definitions. Okay. Do not worry. I will explain how to select the PDX and all. I will help you. I will teach you. Don't worry. Do not deviate on that concept. Now you can understand the PCS leading.
Okay.
If we go for that now, we can't able to continue the syllabus. We can go with concept wise, then you will get idea. I will explain, don't worry, how to select the PDX, SDX, procedures, everything. That definitions and all. Now you understand the excision and resection route operation, PCS book leading. These three things tell me excision and resection root operations understood.
Yes.
Yes, sir.
How you get the multiple choice question in the PCS, how to get the case study in the PCS, you get idea.
Yes.
Not understood, no problem.
Sir.
Idea
Yes,
you
sir.
get now. Then we can go with the next root operation, detachment. Note down. Detachment, 6 value. Detachment means amputation, guys. Amputation. Anybody have idea about amputation?
Removal of upper or lower extremities.
Removal of upper or lower extremity, not body part, only extremity cutting. Removal of fingers, hands, legs, toes, finger, foot, whatever. Upper or lower extremity removal should be considered as amputation. You will get the amputation procedure in the document. The root operation should be detachment. We have only two body systems related to detachment, guys. 0x6, 0y6. Upper extremities and lower extremities. Okay. Only two body system related procedures you will get in the detachment. Upper extremities, lower extremities. 0x6 or 0y6. Like this only your procedure start. 0x6, note down upper extremities. 0y6, lower extremities. Only two body system related procedures you will get. If you observe under detachment heading in the book also, you will get all the extremity related body parts. Go through the detachment heading in the index. Check under detachment. See here, the given detachment. See, arm, elbow, femoral, finger, all are extremity related only will get. Foot, leg, toe, thumb, shoulder, knee, hand, forequarter. So all the extremities related only we are seeing, right? Body parts. Yes or no? And minimum six digit code you are getting in the index only. Because detachment they will perform only in open approach and they don't place any device. So they given 6-digit code beside the code. 6 digit you are getting in the index itself, correct? Just we need to identify the qualifier in the detachment. 6 digit you will get in index itself. Got it?
Yes.
Identify the code for this procedure. Like this, we get the procedure done. Where they perform the procedure?
Foot, right? Foot.
Right foot, right? So we need to go with the
So much.
detachment foot, right. 0y6 m0z, correct? Now we need to go for the 0y6 M0Z and identify the qualifier.
Zero Y6 M0ZZ.
ZZ. What is the Z in the qualifier? We have Z in the 7th character.
Yes.
What is the Z? Tell me.
No qualifier.
0, sir. Complete.
We have complete, high, mid, low, right? You have no qualifier option in the
Yes.
0y6? I think no. If we really leaded, why sin we don't have 0y6 Z option? Complete. Where is Z? There is no qualifier in the option.
Okay.
All you are getting. Simply don't tell me no qualifier, nothing. Lead and check. Where is the no qualifier option? If you are not leaded, no problem, but don't tell me unnecessary options. So there is no qualifier option here. You are getting complete, first ray, second ray, partial, second, third, fourth, fifth ray. First and second, third, fourth, fifth ray. Either ray or complete we have. Then how we need to check? How we need to check? It was a complete or partial. Okay. How we need to check? High, mid, low. We have now here. How we need to check the qualifier we can discuss. If you go to the PCS book starting pages, guys, go through the 14th page. Here we have a table for the detachment procedure of extremities. Detachment procedure of extremities. Up to here you can read this table and these two lines. One case study you will get in the exam related to detachment, okay? It was important root operation. Read this table and read this matter. Then you will get idea about detachment qualifiers. So here we have qualifier high, mid, low. If they done the proximal portion of the amputation, high. Distal portion, low. Mid region, shaft, mid. Shaft should be mid. Proximal portion high, distal portion low, shaft should be mid. Then for toes and fingers, foot and hand, when we need to take complete, when we need to take partial, they given clearly here. Read this complete and partial guidelines.
Joint and bone are the difference.
Not joint and bone. They are saying tarsa-metatarsal means complete and carpo-metacarpal complete. Metatarsal bone partial. Metacarpal bone should be the partial. Okay, they are doing carpometacarpal level or tarsometatarsal level, or metacarpal or metatarsal level. Where they are performing the amputation, we need to check. So in the question, where they are performing?
Metatarsal.
Metatarsal or tarsometatarsal?
Metatarsal.
Tarsometatarsal. So which means complete or partial?
Complete.
What is the value for complete?
0.
0. That's it. Here only will get. Hand and foot complete means 0. Zero should be the qualifier. 0 Y6 M0 Z0. Correct? 0 Y6 M0 Z0. Now can you identify one question? Left below knee amputation. This question you will get in exam. Below knee amputation.
Left knee, it will be O Y6 J0Z.
0 Y6.
J0Z.
0 Z.
I didn't get it. 0 1% tell me. 0 Y6.
G0.
G, yeah. G, what is the value?
Knee is left.
Knee. Why we need to take knee here? They are performing the knee amputation.
J0Z.
Lower leg, right? Below knee means lower leg, correct? Below knee means lower leg, right?
Yes.
Yes.
So lower leg left, what is the value?
0 Y6
J.
J 0 Z.
0
Z.
Z qualifier identify.
But here high or low not mentioned.
How to where they done the below knee means lower leg, upper side or lower side,
Okay,
proximal
3.
or distal.
Lower leg.
Lower leg, okay. You taken already body part. Now we need to look for the this thing na qualifier.
Qualifier will be
Proximal or distal, high, mid, low. What qualifier will take?
low.
Proximal.
Lower leg, upper side, which side?
Distal high.
Proximal.
Complete.
Proximal portion.
Proximal. Lower leg distal side, ankle area. Lower leg proximal area means below knee area. So here they done the proximal side. So what is the value for proximal?
1.
1.
1.
That's it. 1. Correct. 0y6J0Z1. This is the procedure leading. So remember, proximal means upper area, below knee means lower leg. Lower leg upper side should be below knee, lower side should be ankle area, distal area ankle, low. Clear detachment. Any doubt? Detachment. Say yes or no. If you are not saying anything, I will move to next question. Root operation.
Yes, sir.
Next root operation, transplantation. Note down the transplantation. Transplantation means organ transplantation. Transplantation means organ transplantation. If they transplant any organ, the root operation considered as transplantation, like lung transplant, liver transplant, kidney transplant, heart transplant. Okay, transplantation of organ should be transplantation root operation. So how they will transplant organ? Tell me. From donor, right?
Yes.
If any donor donated the organ, they will transplant. So here, whenever we are going to quote transplantation, like detachment, 6 digit will get in index itself. Suppose check the left kidney transplantation PCS code. Left kidney transplantation. Left kidney transplantation.
Zero TY
0 TY.
0TY10Z.
6 digit you are getting index, right?
Yes.
If you check, observe the index for all the locations, you are getting 6 digit in the transplantation heading, correct? For all body parts, you are getting 6 digit, right? Not only kidney, heart, liver, all should be they given 6 digit, right? The transplantation, all should be 6 digit they given. Just we need to identify the 7th character. Go to the 7th character in the table. Identify the 7th character. Zero TY 10Z. Okay. Identify the 7th character. What they documented in the 7th character? Tell me.
Allogenic,
Allogenic, syngeneic,
Syngenic.
zooplastic.
Zooplastic, correct? So note down when we need to take allogenic, syngenic, zooplastic. Allogenic. Allogenic means donor matched organ. Donor. Any donor matched or family member if they donated, or brain dead person if they donated, it should be allogenic. Syngenic. Identical twin brother or twin sister. Not family members, only identical twin brother or twin sister. identical twin brother or twin sister. Zooplastic means animal. Zooplastic animal. Allogenic 0, right?
Yes, sir.
Equal 1. Definitely they will give how they transplanted, okay? Compulsory they will document from where they taken, who was the donor. They will definitely document. Suppose left kidney transplantation from brain dead person. What is the complete code?
0.
0, correct?
0.
Suppose kidney transplanted from the identical twin brother.
1.
1.
1. Okay? 1. Like this, we need to identify the qualifier there. Clear transplantation. Next root operation method. Reposition. Reposition. So what they are saying, re means again. Position means same place. Any body part. It was moving from original position to abnormal position. Again, they will put in the same position. Sometimes same position was not functioning properly. They will move to the suitable location. They will move to the suitable location. It should be repositioned, moving to its normal location or other suitable location. All are a portion of body part. Any body part move from original position to abnormal position. Again, they will put in the same normal location or other suitable location. It was repositioned. Again, put in the same position. Here you will get mostly fracture reductions. Fracture reductions. Okay. Mostly will get fracture reductions in the reposition. Fracture means
Breaking
breaking of bone, right?
Breaking of
Breaking of bone. So if an fracture happened, what is the treatment?
reduction.
Reduction. We need to put breaking of the bone means bone should be moved to the original position to abnormal position. Again, we need to fit in the same position. It should be reposition. So what they will do? Reduction, fracture reduction they will perform. So fracture reduction should be two techniques. Closed reduction, open reduction. Note down. Closed reduction, open reduction. Closed reduction means sometimes they will put external pressure on the skin level and they will reduce the bone fracture. We seen, right? Sometimes they will put a splinting or cemented cast and it will leave 1 month. The bone will be set. Sometimes major fractures means what we need to do? We need to insert the rods, pins, screws, and we need to fix the bone. Correct?
Yes.
Depends on the reduction, how they are doing. So if they're done closed reduction, the approach should be external. If they're done open reduction, open approach. Open reduction, they will do two techniques. Open reduction, internal fixation, external fixation. Internal means inside the bone, they will fix the devices. External means outside the bone, they will fix the devices like rods, plates, screws, pins and all.
புரியல.
Clear?
ஏன்
Yes.
கூட்டு வந்துச்சுடா.
Any doubt?
Sir, can you repeat about open reduction?
Open reduction.
நான் போய் பெட்ரோல் போடுறேன்.
Hello, sir. Your voice is not audible.
Sorry, guys. So, open reduction, internal fixation or external fixation. Open reduction means they will cut the skin and other layers and they will reach the procedure site and they will fix the bone. If they insert inside the bone like screws, pins, blades, internal fixation. Outside the bone, if they fix, it should be external fixation. How they are performing, we need to check internal fixation device or external fixation device. Approach should be open. Clear?
Yes.
Now, you can note down the femoral bone structure. If you go to the femur in the reposition heading, if you go to the femur, we have three types of cords: upper femur, lower femur, femoral shaft. Okay, you will get the case scenario from the femur bone related. So note down when we need to take upper, when we need to take lower. Shaft, mid portion of the femur should be shaft. Upper, head, intertrochanteric, neck area, proximal area. Lower, distal or condylar area. If they're done, it should be lower.
Hello, sir. Can you repeat, sir?
Note down here only we have no. When we need to take upper femur, when we need to take lower femur. If you go to the reposition femur, you will get three types of cords: upper femur, lower femur, femoral shaft. When we need to take upper femur, when we need to take lower femur, here I already written, note down. Shaft means directly you go with shaft, mid portion. Noted?
Yes. Yes.
If you noted, lead the procedure left femoral intertrochanteric fracture, open reduction, internal fixation device. Left femoral intertrochanteric fracture, open reduction, internal fixation. Done. Lead it, guys.
Yes.
Yes, sir. Tell me the under reposition, femur, upper. Intertrochanteric means upper area. Left. What you found?
OQS7.
4L.
0QS7, right?
7.
Under reposition check. Zero QS7.
0.
Open reduction. Open reduction
Internal.
internal fixation means 0. Then internal fixation. What is the device value?
4.
4.
4. Z. Suppose if they mention internal fixation, intramedullary, then
6.
6. Okay. What they are performing, we need to check. 0QS7 0 4 Z.
సార్ ఓపెన్ అని ఎలా ఐడెంటిఫై చేస్తారు?
ఇక్కడ చెప్పారు కదండి ఏం చేస్తున్నారు ప్రొసీజర్. ఓపెన్ రిడక్షన్ అంటున్నాడు కదా, ఓపెన్. Closed reduction means they will put like casting or splint. I will show the example. Closed reduction ఎలా వస్తుందో చూపిస్తాను చూడండి. ఇదిగోండి ఇలా మనకి ప్రొసీజర్ ఇచ్చారు. ఇక్కడ చూడండి, వాజ్ రెడ్యూస్డ్ అండ్ క్యాస్టెడ్ ద ప్రాక్సిమల్ ప్యాలెన్స్. జస్ట్ క్యాస్ట్ వేసారు, షార్ట్ టర్మ్ క్యాస్ట్ వాస్ అప్లైడ్. రిడక్షన్ అని ఎక్కడా చెప్తలేరు మీకు ఇక్కడ. ఇలా జస్ట్ క్యాస్ట్ వేసి వదిలేసారు అనుకోండి, ఇట్ షుడ్ బి క్లోజ్డ్. అదే మీకు ఓపెన్ అనుకోండి, ఓపెన్ రిడక్షన్ అని క్లియర్ గా చెప్తారు అనమాట.
ఓకే.
ఇదిగోండి ఇక్కడ చూడండి, ఈ 17th క్వశ్చన్ డాక్యుమెంటేషన్ చదవండి, మీకు అర్థమవుతుంది. ఇక్కడ చెప్పారు చూడండి, షీ అండర్వెంట్ అండ్ ఓపెన్ రిడక్షన్ ఇంటర్నల్ ఫిక్సేషన్ ఆఫ్ ద ఫ్రాక్చర్. ఓపెన్ రిడక్షన్ అని క్లియర్ గా చెప్తారు మీకు డాక్యుమెంట్. క్లియర్?
ఎస్ సార్.
Thank you guys. So for tomorrow, yeah, tell me.
The recording has stopped.
For tomorrow, you can learn the root operation definitions of drainage, extirpation. Read before the class, guys. Fragmentation, Without your support, we can't able to complete your certification. నేనేం రాయను కదా, ఎగ్జామ్ మీరే రాస్తారు కాబట్టి మీరే చదువుకోండి. డ్రైనేజ్, ఎక్స్టిర్పేషన్, ఫ్రాగ్మెంటేషన్, ఇన్సర్షన్, bypass, replacement. These 5 root operations you can learn. 6 root operations total. Read the definitions before going to the class. We can discuss. Tomorrow we can discuss these 6 root operations. We can read the definitions before the class, guys. I will ask the questions.
Okay,
Note
sir.
down the root operations. You will get in the PCS book under Appendix B. Drainage, extirpation, fragmentation, insertion, bypass, replacement. Clear? That's it for today. All are having doubts, you can ask me. For not having doubts, you can leave for the session.
Thank you, sir.
For ORI, open reduction internal fixation, they will directly mention it with ORIF or OREF.
Yeah, they will give ORIF sometimes. Sometimes they will give like this, open reduction internal fixation. Either abbreviation or definition they will give.
Like they will mention that one, like they
Yeah,
reduction
definitely they
that
will mention in the question how they are doing reduction.
Okay.
Clearly they document. చెప్పండి.
Is class a cast placement in closed reduction?
Yes. Cast means externally on the skin level they apply the cast. No, it should be closed reduction. External approach. Or only they apply the splint. Closed reduction.
Okay, thank you, sir.
Yes, yes.
Sir, can you teach me how to book lead? Actually,
So
I am.
Tell me.
Sir, book leading. I need to learn book leading. How to
Open your PCS PDF.
సార్ ఈ క్లాస్ రికార్డింగ్ పంపిస్తారా?
Yeah, every class I will say.
ఓకే సార్, థ్యాంక్ యూ.
సార్ నాకు చిన్న డౌట్ సార్.
అడగండి.
అది మీరు ఒకసారి మొన్న అది సిపిటి టెస్ట్ లింక్ పంపారు కదా సార్.
అవునవును.
అది టెస్ట్ రాసిన తర్వాత మేము రివ్యూ చేసుకోవడానికి రావట్లేదా సార్?
నేను చెప్తానండి ప్రాసెస్. అది యాప్ డౌన్లోడ్ చేసుకోవాలి, రివ్యూ వస్తుంది.
డౌన్లోడ్ చేసిన సార్, బట్ దాంట్లో ఏం రావట్లేదు.
నేను చెప్తాను ఎలా చేసుకోవాలి.
ఓకే సార్, థ్యాంక్ యూ సార్.
సార్ ఇప్పుడు డ్రైనేజీ, ఫ్రాగ్మెంటేషన్ ఇవన్నీ దేని కిందకు వస్తాయి సార్? ఏ బాడీ పార్ట్ కిందకు వస్తాయి?
రూట్ ఆపరేషన్స్ అండి.
ఓకే.
That all are root operation names. You will get in the root operation definitions page. Total we have 31 root operations now. So if we learn daily 3 root operation, it will take 10 days. So you need to learn yourself also some root operations. అన్ని మీరు చెప్పండి, నేను వింటా అన్నాం అనుకోండి, it will be go with 10 to 15 days only PCS. That's why. So here book leading check. First you need to open the table of contents. Opened. Who are having book leading doubt, you open the book or PDF or not?
Yes, sir.
Opened, no? So you seen the same page?
Yes, sir.
So here we need to check index and tables. Okay? Have you find index and tables?
Yes, sir.
See, fatafat reply if you give, I explain. మీరు సైలెంట్ ఉండి నేను చదువుకోబో అంటే నాకు అవ్వదండి. మీరు రిప్లై ఇస్తా అంటేనే నేను చెప్తాను.
Yes, sir, we have opened.
Open, no? So if you have any leading, first we need to identify the root operation of your procedure. Without identification of root operation, we can't get the code. After identifying the root operation, go through the index. Under root operation heading, check the body part.
Sir,
Okay.
sir, can you record this also?
No, I already stopped the recording.
Sir, particularly
Because
this
I
part is
already
very
explained
important, sir.
same thing yesterday itself.
Yeah,
Today,
but
starting class I shown same thing. How to use the book, starting 10 to 15 minutes, I explained the same thing. Have you joined?
Yes, I have joined, sir. Okay, then I will go with that.
Doubts?
Sir, continue, sir.
Or not?
Sir, your voice is breaking. Can you repeat?
What I am saying, are you there or not, who are having book leading doubt?
Yes, sir, here only.
Yes, sir, I am. Yes, sir.
So you need to open the index, check the root operation heading. Whatever procedure they performed, first you need to identify the root operation. It was possible or not? Are you able to find the root operation for the procedure?
Yes, sir.
Yes, right? You are able to identify the root operation. Then go to the particular root operation heading. Suppose they done left lung completely removed. You can do this code leading. Then you will get idea. Left lung completely removed. What is the root operation? Who are having doubt, they only reply. Who already know, just watch if you are still in the meeting. What is the root operation?
Resection.
Resection. Who are having doubt, then only reply. Book leading. Who are having already leading everything, stay or leave. Resection, right?
Yes, sir.
Now you need
Yes,
to
sir.
go for the resection heading in the book. Go to the resection heading in the book. Have you find resection heading in the index or not?
Yes, sir.
Yes, right. iPhone user, they are not mentioned the
No,
name. So
sir. No.
for you only I am explaining. Now you need to reply. Other people are giving reply. So you find the resection or not?
No, sir.
Where you are in the book? Tell me. I will explain. Where you are in the index? Tell me. I will explain. In which page you are? ఏ పేజ్ చెప్పండి తెలుగు అవుతే.
Page number 1, table of contents, ICD-10 PCS index.
టేబుల్ ఆఫ్ కంటెంట్స్ లోనే ఆగిపోయారా మీరు? ఇక్కడ ఆగిపోయారు అవునా?
Sorry, sir, I can't understand.
విచ్ లాంగ్వేజ్ యు ఆర్?
Hindi or English?
यू आर हिंदी.
Yes.
टेबल ऑफ कंटेंट्स में है क्या तुम?
Yes, sir.
अभी चेक करो. ICD-10 PCS इंडेक्स है ना हेडिंग?
Yes, sir.
ये
51.
इंडेक्स पर जाओ. कितना पेज से स्टार्ट हो जाएगा? 51 से है ना?
Yes, sir.
गो फॉर द पर्टिकुलर पेज. You seen this?
Yes, yes, sir. Yes, sir.
Here, index like dictionary, A to Z series. The procedure start with A, B, C, D. I said resection. So you need to go for the resection heading in the index. Check the resection in heading index. If you go like this, A series, B series, you will get the R series.
151, sir, page number.
No, I need who are having doubt, they need to lead. That's why I'm not saying. You who already know, just leave it better. Or have idea, they will get. If you are answering, they can't able to find. You can go like this. The top you will get. You are in which page? B series, B series. You need R series, right?
Okay, sir. Okay, understood.
You can go for the R series, resection.
Yes, sir.
Still,
Wait.
under the resection, lung. Release. Repair. Resection. Under resection. Here resection. Under resection, check the lung. Lung. Under lung, left. 0 BTL, correct? How you find?
Sure.
Ma'am, have you identified?
Sir, can you tell me page number, please?
Confused. Don't go with page number. If you go with page number, suppose if you are going to get another question, how you will get the page number? Who will tell in the exam? You are in which page? Tell me, I will help you.
152.
Page number don't tell. Here, in the headings, tell me. Resection or reposition, what you are seeing in the book, tell me.
Resection.
Under resection, check the value. Lung. We are having A to Z. Again, under resection, you will get A to Z. L. Lung means L, right?
Yes,
LUNG. Lung. Under lung, left. Fine.
Yes, sir.
That's it, guys. If you find the 4-digit code, you can go with again table of contents. Under the tables, you will get 0 B series in which page number? Here check. 0 BT. 0 B series in this page range. We need to go for this page range. Again, we need to look for the T. Zero B1. We need T, so we need to go for the pages. Yesterday recorded video already explained how to use the book leading. Watch it. And today also I explained the book leading. Watch it, the videos. Then you will get your idea. 0
Okay, thank you.
BTL. 0, Z. Clear?
Okay, sir.
Have you understood or not? Don't tell me simply okay. If you are not understood, tell me, I will explain again and again.
So after getting that 4-digit value, again we will come to the table of content, right?
We need
From
to come to the
there,
table of contents. We need to check that series start on the particular which page. 0B series, T series, M series. Which series we need to check the page now. We need to go for the code.
here there is a confusion. Sir, ఇక్కడ కొంచెం కన్ఫ్యూజన్ ఉంది సార్. ఆఫ్టర్ టేబుల్ ఆఫ్ అంటే 0BTL రిసెక్షన్ అక్కడి వరకు ఫైండ్ అవుట్ చేసాం. సో మళ్ళీ
0BT
ఇక్కడ
వరకు వెళ్ళారా?
వెళ్ళాం సార్.
టేబుల్ వరకు వెళ్ళారు.
అవును సార్.
సో ఇక్కడ చూడండి 0BTకి వచ్చారు. ఇక్కడ మనకి ఏంటి fourth character already will get in the index, right? While we are code leading, fourth character were already get in the index, correct?
Fourth character is lung, sir. I mean,
you will get in index, right? I am asking any procedure, you will get in index, right?
Yes, sir.
While we are leading a code in the index, automatically we will get first 4 digits. So fourth character also will get in the index, correct?
Yes, sir. Yes, sir. Clear.
Then we need to identify approach, device, qualifier. These 3 things. So any procedure, check. In the procedure note, what approach they used. If they not mentioned any scopy, it should be open. If they done incision or puncture, percutaneous. If they mentioned scopies, we need to go with particular scopy approach. You will get the 5th character. If they mentioned any device, you will get the device. If they not mentioned, no device. If they mention any qualifier, we go with qualifier. Otherwise, no qualifier. That's it.
ఇక్కడ ఇవ్వలేదు కదా సార్ లంగ్ లెఫ్ట్ ఇక్కడ అప్రోచ్ డివైస్ క్వాలిఫైర్ అప్పుడు ఏమి
ఇవ్వాలి 0ZZ.
ఓకే.
Suppose they mentioned like laparoscopic lobectomy or thoracoscopic lobectomy, then 4.
Yes, sir. Now we are getting idea.
0BTJ 0ZZ ఇవ్వాలా సార్?
0BTL, right? Why you will get J?
L, sorry, L.
Left lung, no? You suppose if they done lower lobe lung left means J.
Yeah.
Only left lung means L.
Yeah. L 0ZZ, right, sir? ఇక్కడ code.
That's it.
Yeah.
Correct. Clear, everyone?
Yes, sir. Now we are clear. Yes, sir.
Still any doubt?
బట్ ఇక్కడ లెఫ్ట్ సార్ లంగ్ లెఫ్ట్ కింద స్ట్రైట్ గా ఏమి ఇవ్వలేదు కదా సార్?
స్ట్రైట్ గా ఏమి ఇవ్వాల్సిన అవసరం లేదండి మనకి. ఈ టేబుల్ మొత్తంలో ఇవి తీసుకోవచ్చు. ఈ బాడీ పార్ట్స్ అన్నిటికీ ఈ 2 అప్రోచ్ డివైస్ క్వాలిఫైర్ అన్నమాట. ప్రతి దానికి స్ట్రైట్ గా ఉండాల్సిన అవసరం లేదు మనకి. ఈ టేబుల్ లైన్ కొట్టారు చూసారా కింద, ఇక్కడ ఈ లైన్ క్రాస్ అవ్వకుంటే చాలు అన్నమాట. మనం ఏదైనా టేబుల్లో ఇలా ప్రతి దానికి స్ట్రైట్ గా ఇవ్వరు. ఈ లైన్స్ ఉన్నాయి చూసారు, ఈ లైన్స్ క్రాస్ అవ్వకూడదు. మనం ఇక్కడ బాడీ పార్ట్ తీసుకొని ఇక్కడ అప్రోచ్, మళ్ళీ ఇక్కడ డివైస్, ఇక్కడ క్వాలిఫైర్ ఇలా తీసుకోకూడదు. ఈ టేబుల్లో స్ట్రైట్ గా ఉండాలి అంతే. ఈ టేబుల్ వరకు ఉంటే చాలు. మీరు బాడీ పార్ట్ పక్కన ఏమి ఇవ్వలేదు అనేది అవసరం లేదు. ఈ బాడీ పార్ట్స్ అన్నిటికీ ఇవే అప్రోచెస్, ఇవే డివైజెస్ అన్నమాట. క్లియరా?
ఎస్ సార్.
Clear? Okay guys, then bye bye.
Thank you, sir.
Thank you.